With dangerous heat continuing across Connecticut, health officials are urging people to take extra precautions to stay safe.
Yeah, joining us live to tell us more is Dr. Cynthia Price with Emergency Medicine at Hartford Hospital. Good morning, Dr. Price. Thanks for being here.
Good morning. Appreciate the ask to keep people safe.
Good morning.
Of course, that is what it's all about. A really important conversation as those temperatures start to heat up. So in saying that, what are you seeing right now at Hartford Healthcare in terms of heat-related hospitalizations, and who would you say is most at risk for heat stroke?
So I worked yesterday and we are already seeing people that have passed out working in the yard, working outside, athletes that are underestimating how hot it is outside and doing their normal jogging, but we can't do that jogging at 1 o'clock in the afternoon like maybe we could normally. So we are absolutely seeing more heat related illnesses, people that even sitting in the car with the windows up, if you don't have adequate aeration, adequate air conditioning, those people are getting overheated even in the car.
Yes, I know it is unfortunate, and unfortunately we talk about this often in the summer months, but this heat that we are experiencing, it is severe. So when it comes to hydration, we know that hydration is key. What are the best tips though? Sometimes water isn't enough.
Well, water is great, so I don't want to downplay the importance of water. I think the things we stay away from should be sugary sodas, those alcohol, coffee. Those things do not replace water. And so when you guys are out in this heat, and for us, this is a really protracted heat wave. This is the next 4 or 5 days. You guys should be drinking probably 8 ounces every 30 minutes. Like when you pick up that water bottle, you should be getting at least 8 to 10 sips in. You should be monitoring how hydrated you're staying. If you are waiting until you are thirsty, it's too late. So stay hydrated while you're out there. You guys can also watch the color of your urine. You know, if you are hydrated, it tends to be clear and not so concentrated. And if you are getting to where things look super concentrated and dark, that is a sign you do not have enough hydration. So every 20 minutes or so, make sure you are getting in some sort of hydration. And like you said, the things that I think are better than water at times, if you sweat heavily, you should be using the electrolyte replacement. Maybe something like Gatorade. I don't want to go brand name, but electrolyte water, and you can get those in the powders and add them to your water,
Right.
or you can buy them intact. But definitely coconut water is one of those things. So it's a combination of the good stuff and staying away from the bad stuff.
That's right.
All good, really important reminders there. Let's talk about the signs of heat stroke quickly. At what point should somebody check themselves into the ER,
If
doctor?
you pass out, come on in. And that's what we've been seeing mostly. People feel a little dizzy and they think, okay, I'm getting hot, and they get inside, but then they don't make it. Or they re-engage the activity and then they pass out the second time. If you stop sweating, come in to see us. If you're sweating heavily, get inside. If you feel overheated, get inside. If you get a mild headache, dizziness, get inside. Anything beyond those things, come on in and see us. We'll help get you cool. There are many, many cooling shelters out there. 211 has availability for everything, the public libraries, even getting on an air conditioning city bus if you are undomiciled will keep you safe in this really hot weather.
Yes, well said, Dr. Price. Thank you. We know that, of course, you are busy with this heat and with the upcoming holiday as well. So thank you for the work that you do.
Thank you, doctor.
Very much. Keep safe, everybody. Appreciate it. Have a good day.
Thank you.